And our next talk is going to be on living with cancer when you have an early stage diagnosis. And this is going to be moderated by Deb Maskins.
Oh, hi.
Oh, Stephanie, sorry.
It's okay. I was like, Deb. Hi, everybody. I'm Stephanie Berg. I'm a GU medical oncologist here at Loyola University Medical Center. Thank you again to Sally and the KCA for allowing me to moderate this session this afternoon. And it was really great hearing so far today everyone's experiences with all the different stages of going through kidney cancer diagnosis. And so I really hope everyone's getting a lot out of it, because I know I am on this side. And we have a few patients here that I see that I've met before. I know they can introduce themselves. We're going to take about 5 minutes to do this, and then about 35 minutes for some questions that I'm going to ask them, and then we'll wrap up with some audience questions if available. So I have about 5 for total to ask everybody, but we can start off with, I guess I'm just going to go in order of the Zoom. So maybe Ryan, and then Anna Maria, and then Jason, just give a quick introduction, who you are, your kidney cancer, a brief journey, what you experienced, and then we'll go into questions. So go ahead.
Sure. Hi, I'm Ryan Natsky. I live in Middleton, Wisconsin, just outside of Madison. For work, I'm a lobbyist actually for a large rural healthcare system. And I was diagnosed a little over 6 years ago. In my right kidney, it was an incidental finding, RCC, and there were multiple tumors, but it was still regular RCC, and they removed it about a month or two later. I've been having it was 6-month scans for a while, and now I'm doing the annual checkups, and so good so far until you start worrying for my next scans in November. But for right now, everything has been good. And yeah, that's a little bit about my background.
Thank you so much. Anna Maria?
Anna Maria. Hi, I'm Anna Maria
Sorry.
No worries. So my name is actually legally spelled with an I, and then like a couple of decades, like 2 decades ago when I started my career as a journalist, I decided to be unique, and it's been messing up people since then. So I guess that's my contribution to society, messing with people. But yeah, so I'm Anna Maria Scaccia. I'm based in Austin, Texas, but I am from Brooklyn, New York. I am a journalist. I'm writing. I'm working as a writer in the corporate world. So made that decision to sell my soul. After 15 years, I was diagnosed going on a year ago. September 30th of 2020 was when I was diagnosed with chromosomal renal cell carcinoma. I was stage 1, but I had a full nephrectomy on my left kidney because the tumor was close to my renal veins and arteries, and so they didn't want to risk leaving cancer cells behind. So I'm on 6-month scans, but right now I took my year scan and I haven't heard anything back. So I'm hoping no news is good news. So.
Thank you so much. And last but not least, Jason, all the way over in Seattle, right?
Yes. So hi, my name is Jason Hinojosa. I am originally from Houston, Texas, but currently based in Seattle. As a profession, I'm a digital marketer for technology startups up here in the Pacific Northwest. And I've actually had to deal with RCC twice in my life. Initially, 11 years ago or 10 years ago, when in my late 20s, it's Super Bowl Sunday, 2011. Actually got a kidney stone at a coffee shop while I was with some friends. We immediately rushed me to the emergency room because no one had any idea what was happening, and when they did like a routine ultrasound in my abdominal area, they found a kidney stone on my right kidney. Left kidney had a huge mass over it. I immediately met with a specialist, had a full nephrectomy at 28, and then really went through 9 years or 8.5 years so of being clean. And then last October was going in for my my biannual checkup as I normally do. And again, they found another mass on my right kidney, my last remaining kidney. So then shortly thereafter, a couple of weeks after that, got a partial nephrectomy. In both cases, they were RCC, the renal carcinoma, carcinoma. And now I got that removed, and I just had my 6-month appointment a couple of months ago and clear. And now I've transitioned to yearly appointments.
That's great. I mean, all of you are missing parts of your kidney, right? And I think one of the big questions that, when I see a patient as well in my clinic is when you're diagnosed, especially with early stage cancer, who was part of your care team? I mean, has it changed? I mean, a lot of you I know for 2 of you, it's been a little bit newer, but when you got that early stage versus, I know there's going to be discussions about a later stage, what was kind of discussed with you? Because as a medical oncologist, I do the IOs and all that stuff. But I know most actually see urologists and not necessarily urologic oncologists. So we can start with Anna Maria, and now I know what the Y, and then we'll go down to Ryan, and then we'll end with Jason again. Just give me that, because I always am very curious about that, because it's we are not all created equal, but we're all on the team. But you know what I mean? Yeah, go ahead.
Yeah. So I have a urologist and an oncologist. So they're separate, but they're very close in contact. So so I didn't include this part. The way mine was found was incidental as well. I went in just for like a yearly physical. My doctor didn't like how high my creatinine and other levels were for my age and my fitness. And so she sent me, we checked a few variables and it was still too high. So she sent me for an MRI. And the guy was like, well, not MRI, first the ultrasound. And then he was like, no, you need to go for the MRI. And then that's how it was diagnosed. So it was because of that. So yeah, those are the people who are part of my care team. It's just my urologist and my oncologist. And I also have a nephrologist, but I'm in the process of moving to a new one.
What about the treatment options? A little bit about that.
My urologist was like straight to surgery. I was diagnosed on the 30th of September. I got my God, I can't adult today. And I got my surgery on October 26th. So it was very quick. But I went straight to the urologist and he's like, nope, you're going straight for surgery. I know it's cancer. We don't even have to do a biopsy. And turned out it was chromophobe.
Which a biopsy we can get into a little bit later is always a very controversial topic in kidney cancer. All right, Jason, you're up next.
All right. So in both cases, I worked with the urologist. And the first time, because I didn't have a history with with anything with my kidney, I was just referred to a urologist from the emergency room. And similar to Anna Maria, it was strongly suggested that based on the size of the mass on my kidney, that I just allow my healthy kidney to recover from the kidney stone, which took about a month, and then let's go right in and remove that. And then afterwards, I started working with a urologist. About 8 months after my surgery, I moved. That's when I made the move across country from Houston to Seattle. So I worked with the urologist that did my surgery in Houston up through I was released, and then I picked up a new urologist here in Seattle, and I worked with the urologist that whole 8.5 years or so. Until this last time, and now I'm starting to work with my same urologist. I have a specific surgery urologist, so a guy up here who specializes specifically on partial nephrectomies. And so I have 2 urologists and then a nephrologist who's helping me work through my just kidney function and understanding how that piece works. And no oncologist, no oncologist. And I did slightly for a short period of time do some DNA work as well, given this was my second time when you wanted to understand where this was coming from. But they're not, that was a one-time test, and that's my pure, that was just a one-time thing, and I'm not part of my regular medical team.
I would have suggested that for you too, genetic counseling, right?
Yes.
All right, Ryan, up there north of me in Wisconsin, who's your care team? And
I had gone in originally for an ultrasound of my liver enzymes were elevated, as a result of, living in Wisconsin and being a lobbyist. And so when they did that, they noticed these cysts on my kidney. And so they sent me to go get a scan of that. And then when I got the scan back, that's when they said, oh, we're going to have you refer you to a urologic in Madison at UW, at the urologic oncologist. Now, I was talking to him, and I had a urologist that I just knew that worked at the system that I work for. So those are kind of the two people I was talking to make my decision. But I was really leaning. It was my urologic oncologist is my main person I was working with. And for me, it was, and you're going to know the specific terms on this, but it was the kind of cyst that it was right on that edge of, they thought it was probably cancerous, but like they didn't know for sure. And so we kind of went through this like debating period of like, all right, should we take it out? Should we wait and monitor it? I'm kind of like, just get this thing the hell out of my body. Like that tends to be where I'm at. And so that's ultimately the decision that we took, which was the right one, once the pathology came back. Once I was done with that, yeah, my care team has been my urologic oncologist. I did see a nephrologist right away, just to kind of learn more and make sure that I was on the right path with that. I mean, I'm at that kind of chronic kidney stage 3, I'm right around that 60 level, but I've dipped below it. So, it's kind of always right in that area, but it stayed steady for all these years. And so I don't see a nephrologist regularly anymore. But I do have my GFR checked, annually when I do my checkups. And then, so those are the main parts of my care team.
So it seems pretty similar. I think Anna Maria is the only one with one of me on your team.
Mm-hmm.
One of the things I wanted to ask you guys, when you come to, your appointment, it is usually a urologist that sees it because it's like a kidney mass. The urologists are kidney people. Did any of the urologists, when they were kind of talking about surgery, I mean, getting your kidney removed is quite, granted, we have 2, so it's very nice it's easier to say to remove it, to get a second opinion at all when you had this diagnosis, or to even recommend that biopsy? Because it is very controversial. Did they talk to you about that? Because again, it's kind of like we have another tumor called hepatocellular carcinoma where we can just kind of treat without biopsies. But I would like to hear more about that, because I know as in GU, we don't get a lot of referrals for early stage, but sometimes we do, and we help kind of navigate that and what that meant for you guys to get more information in the beginning. We'll start with Ryan again. Keep him talking.
We had discussed doing a biopsy, but I mean, and I had read as soon as I found out anything, I was all over the internet and I was reading. I mean, for better or worse, that's what I needed to do for myself, just to feel like I had some level of control over something that felt completely uncontrollable. So I was, when we were talking about that, it just was clear. It was clear, or we understood that there probably wasn't going to be a lot of value in getting a biopsy. That was the decision that we had all kind of come to, and that was what the evidence had led us towards. So that's really where we're on that. One thing I would add, I had the DNA testing as well, to see if there are any markers. I think those tests keep getting better, but I mean, nothing showed up at the time, but so I done one of those as well.
All right, Jason.
Yes. So my first time around, my doctor in Houston definitely suggested that if I didn't feel comfortable with this diagnosis, to go after a second opinion. But he did come back around and say, "Well, you may be able to find a doctor that says they don't want to take it out based on this." I'm just, and again, I was also 28, relatively really healthy person. I was a college athlete, always in pretty decent shape. And so he's just like, just so you know, though, if you do find someone who doesn't want to take this out, like, I would be really wary based on its size, based on your age, based on it being a kidney. I really highly recommend you take it out. Like, you don't want something like this to stick around inside of you, even if it's not. We'll perform a biopsy after we take it out and confirm what it is. But like, I highly recommend you take it out. And if a doctor tells you not to, then don't. And then kind of the second time around, it was a bit trickier because it was a smaller mass this time around, but I still had just one remaining kidney. And so it's like, okay, what do you do here? And I actually, my urologist, who does actually perform, my traditional urologist, who actually does perform some surgeries, was just like, I don't feel comfortable doing this. There's a specialist here in that focuses on like the Da Vinci method of surgeries, and he actually teaches that. He's really well known for doing this particular type of surgery, especially on the partial. And I highly recommend you get in with them as fast as you can. And it took, I mean, I think it took longer for me to even get into his queue to talk to me. I think it took like 4 days from like me first contacting them. This all happened on a Friday. And so basically like Monday morning, you need to call the doctor and get on their list. And it took me to about Thursday until they could actually call me. And then Friday, he's like, we have an appointment for you on Monday. We recommend you going in. And yeah. And so that time around as well, he was just like, this is your last remaining kidney. You need to take care of this. Like if you had two, I might have recommended monitoring this, but because you only have one, we want to get this out as quickly as possible. And we want to take out as few little of the margins as possible. Cause now I'm living with like 95% of a kidney ish, 98% of a kidney. And so that was the real focus there. Now even with continuous focus, it's like, I'm going to go in every year and do a CT scan to make sure there's no growth, and that there is. We're going to try to like basically nip off little pieces of it as I get older.
Anna Maria.
I honestly completely forgot the question. I was like so enthralled with everyone's like with Ryan and Jason's answers, especially since it's like so similar to my story that I'm like, what is actually the question?
It was about second opinions and
kind of like he did not suggest a second opinion because he was just so certain that it was cancer. And his thing was because of my age, because I'm female, and he was my surgeon too, because he didn't see a lot of young women coming with a cancerous mass on their kidney. He was just so certain that it was cancer, and he was like, no, let's just go in and get it out of you. And I believe he also specializes in the Da Vinci method. So I didn't have open, I had the robotic nephrectomy. So that made healing a lot easier. But he was just like, we're going in. And then I got called like 2 days later, like, okay, this is your appointment for your surgery. There you go.
Yeah, they don't mess around most of the time. Just like, for patients that we find testicular masses with germ cell tumors, it's like in and out really quickly, which I know, a lot of my patients have reported too. When you go in, like all of your stories are very similar, where it's like, I didn't even have pain. My lab was abnormal. I had a kidney stone. My liver was abnormal. And all of a sudden you get thrown into this diagnosis. You have this large kidney mass. You probably didn't even know that kidney cancer was even a thing. Really, you don't like think about it. It's not one of the, top cancers, we should say. But how was your kind of mental state during this? I mean, they want you to do surgery right away, not getting a second opinion. What were your feelings, involved, that how you felt about that? And even afterwards about just kind of going through that, I would, it just seems it's just a whirlwind, and it has to be for good reason because of what it is, but it's, I know it can be tough. So we're going to go back to Ryan on that one.
Yeah, that was frankly, I mean, the physical, you recover from surgery in a few days. I mean, it doesn't feel great, but you recover, and that's not that huge of a hurdle. More than any physical pain was certainly the mental, just the anxiety and the stress and everything that goes along with that side of it. And so, I mean, you immediately go to, I've got a kid, how long am I going to be alive to watch them? And that devastates you, just going to worst case scenario. I mean, I immediately just thought, all right, I've got 2 years left. And I mean, that's just automatically where I was. And when I started, I think it was like every 8 seconds, like that's probably why I thought about the word cancer. It's just like there, it's like, you can't escape it. And over time, it just kind of slowly, just becomes less and less that you think about it. And it's not as in your face until, you got to go for your scans, and then, you got to think about it again. But otherwise, it just continually gets better. But that was definitely, and for me, I found message boards. I just want to find other people that had been alive for 10 or 15 years and that were fine, that had what I had. And I didn't want a support group of just people that had testicular or other prostate or other cancers. I wanted somebody that had my cancer and knew specifically what I was going through. And that's what actually they had a tough time finding until years later. I found KCA, and I would encourage anybody now that comes in a situation to reach out to KCA to get put into these resources now, because you can find those stories. But so the emotional toll was far heavier than anything else, just because you feel like you don't have other people that understand your exact situation.
Yeah, it can be very isolating, even though you have all these doctors and all your loved ones around you, but you are the one, and you just had your kidney out. And so it's like, what the heck, it's a lot. Anna Maria?
Yeah. So when my first thought is I kind of just resigned myself to the fact that I had cancer. I think when I was told that I had a mass on my kidney, a lot of people around me did not want to believe that it was cancer. And my best friend even suggested it was a kidney stone. I'm like, it's on my kidney, not in it. Like, babe, no. And so for me, like, I immediately went to, well, it's cancer. Like, I know, it's like, I know it's cancer. So now what are we going to do about it? But like Ryan, I also immediately went to like, oh crap, I'm not going to see my kid grow up. And I'm still kind of there, because the way I've put it for like KCA's blog, when I wrote stuff, is like, we have a rare cancer, right? So you can say, oh, reoccurrence is rare, but we had a rare cancer to begin with. So it's like, to us, that means like nothing, like that's not how cancer works. And I try to compartmentalize a lot of it, because, you have a 6-year-old, you have a job, you have all this stuff. Like, I just kind of went into action mode. I ended up starting like a business 3 months later. I, decided we do a competitive bodybuilding, not to like pat myself on the back, but like, that's how I responded. It's like, okay, let me throw myself in everything and anything that I can throw myself, so I can run as far away from my emotions as I can.
I feel you on all those levels. I mean, it's just, as we say, the C word, the cancer word, it comes with a lot of stigma, and it's no matter if you're early stage 1, 2, 3, or 4, or whatever it is, it's just a lot to handle.
And just, I wanted to say really quickly before Jason jumps in. So I think the one thing that did make me feel at peace. So my older sister had Hodgkin's lymphoma, like when in her 20s. She's 40 now, and she's been in remission for a bit. So when my mom told my sisters that I had a mass on my kidney before we found out it was cancer, she emailed me and said, can we talk? Because at that point we weren't talking. Because she like knew, like she was the only one who did not try to explain it away. Like she just knew what it was. And to have somebody come to me and be like, no, I know what it is, and I know you're feeling a certain way, so talk to me, that really helped put me in a better headspace than I think I would have been. Not that that's a good one, but still.
Right. Put you in the headspace where you needed to be, and it helped. Absolutely. Absolutely. All right, Jason, you're up.
I would say, initially I had a very similar response to Anna Marie. I was young. I had never at this point in my life had gone through any kind of sickness of any kind. I was single. I was partying a ton in my free time, and I think initially it just sort of hit me on like really looking internally, because at the same time that I was going through this as well, a really close family friend of ours also got diagnosed with a different kind of cancer in later stages and passed away, all within the period of time of me. We almost like identically lined up, and so I really started thinking like more so like, what am I doing with my life? Like, obviously, like this family friend has kids and a wife and these important things, and I'm over here just this sort of like selfish, single, youngster, partying my life away. Like, what am I doing? And that's like what really spurred the moment of me going back to school, getting an MBA, moving to Seattle, go, really just kind of looking internally, like, yeah, just really looking internally, like make my life worth saving, sort of speak, like what do I need to do? What do I need to get a part of? What organizations do I need to do? I need to maximize and squeeze the most out of this life. And the second time around, I think it was less so that and more so just realizing, I think more so thinking about legacy. At the same time, right when I recovered from this, my wife and I also the same week found out we were pregnant. And so we just had our first baby girl, first child, the 1st of July. So almost like identically lined up to when I had the surgery. We came out that day. I came home. She took a pregnancy test. We found out. it was very like almost lined up. And so this time around, I'm thinking more so about, just more so like, what legacy am I going to leave behind? Like now I have a child to think about. Now I have these other things to think about that aren't just like myself. And I don't want to necessarily just throw myself back into some sort of personal project, and more so looking at, more so of looking at like actually feeling the emotions and letting myself feel these emotions. So part of that's, working with the KCA, and really just like wanting to tell my story and show people what's that. But then another part of it's like starting to work with therapists that are like the non-medical side and really thinking about it from a mental state perspective. And like, how do I settle my life now with this child and this diagnosis, and how do I really like set the foundation to say for the next 40 years, like how do I set my life so I can make sure I'm there for when she gets married, when she goes off to college, when she buys a home, and how do I build healthy habits now so to sort of prolong my life, knowing that I have less than a kidney left. And from what I know, the doctor said that you'll probably get this again now, like you've had it twice, you'll probably have another tumor at some point. And so like, what do I do now so that I can be there for her? And so much more thinking about just her, and trying to be less selfish and that piece.
Congratulations, first of all.
You. Right.
You guys' stories is inspiring, and I think that here at Loyola we kind of call it like this extra layer of support. You just have to always like have that support, and it's not just medical, it's not just me or your team just putting on all these guidelines and things like that. It's about that emotional support and just what you're going to do with your life, right? Because technically, right, you got this clean bill of health, perhaps, right? You got your kidney out, everything is good, but that kidney cancer is something that can come back. And Jason's a little too aware of that because it's already happened to him again in a matter of 10 years. So I would like to see, what were you told by your urologist about guidelines? Because we have a lot of things between like ASCO, the AUA, the NCCN, which, for the audience out there is kind of our national guidelines that we use for surveillance and monitoring. So what did you guys understand about that? Meaning like, this is kind of a lifelong, to be honest, type of situation. This, not that we want it to go away, of course, but it's always that reality that you need to sit back and be like, what, it could happen again, and kind of what you were told. So let's go back to Ryan, how we felt about that.
Yeah, so we had walked through what the kind of schedule of scans would be. Kind of, this is what the gold standard is of what we expect, and it's an abdominal MRI and it's a chest CT every 6 months for the first 3 years, and then it's every 1 year to have those. And then after that, then they wanted to go to an ultrasound once a year and a checks X-ray, which is and insurance is following all these as well. And like there's on my left kidney, there's something that they think is fine, but there's a cyst there. There's nothing wrong with it. And so he's like, I mean, if I could get a better picture of it, like I'd rather have one, but like I also don't think you have to have one. So it's like then you work through the insurance companies, then you learn about these guidelines and what they follow and what they cover and what they don't cover. And so that's kind of where I am at on those, and that's kind of how you learn about them.
It's a lot of information. It's a lot.
It's a lot. And I mean, the frustrating thing is that, I mean, you get urologists, they wrote these guidelines, right? But then they're the ones that are arguing with the insurance company about like, Yeah, but we kind of like screwed up when we wrote it. It should actually probably be, we should have left some flexibilities here for different situations that, so.
For sure. Jason?
Yeah, so my future health plans kind of broke down to two tracks. So on one piece, it's like additional mass is growing. And, from that perspective, there's not a ton I can do about that. And there's obviously like healthy eating, and obviously there's exercise and things you can't do, but there's a chance something could grow back or not. And, only destiny can really tell that. And so as that part, that's when I'm going in on an annual like CT scan and ultrasounds, with my urologist, and just monitoring if there's any additional growth, and really trying to find, even a millimeter of growth, like if there's something there, like really trying to pinpoint on the growth piece. And then on the other track of my health is, this is where the nephrologist really came in first part of my health team, is the kidney function perspective. Is now that I don't have a full kidney function, it's monitoring things like my blood pressure, blood sugar, stress levels, overall health, to make sure that nothing as part of my lifestyle or eating habits really affect my kidney to form some sort of kidney disease, or degradation of how my kidney actually functions. And so that's where I'm checking in with her. And currently I'm going with her every 6 months and just getting basic vitals checked and functionality checked. And I think after this next 6 month appointment, which I actually have next month, we'll go to a year, and we'll have like an annual kidney function check, and just make sure that nothing from that perspective is looking off.
Thank you. It's always helpful to have that primary care perspective with your cancer care. I'm actually going to switch a little bit. Anna Maria, there was a question from the audience, like a two-parter. So get ready. So one of them is just to kind of elaborate a little bit more about the biopsies, and I can speak about that from a medical oncologist perspective. The role of biopsies in patients diagnosed with renal masses is, it kind of goes back and forth. It really depends on the size of the renal mass. It really depends on the invasion and the characteristics on advanced imaging. And typically we use renal MRIs. If there's vein involvement, how it looks. We don't usually recommend biopsies if it really looks, if it's quacked like a duck, walks like a duck, quacked like a duck type of situation. So we will recommend a radical nephrectomy. We, meeting mostly urologists, again, I don't see them as a lot of medical oncologists, but if I see them as a consultation in the hospital, we have a discussion at our tumor board. And the other question, and then Anna Maria, just talk a little bit about, with your mass, I know you did a little bit about the biopsy, about there's a patient just diagnosed with stage 2 kidney cancer, and they are unfortunately in denial. And they're just kind of asking how you get rid of those thoughts and kind of go forward with getting that surgery. And they didn't really ask if they had a biopsy or not, and just kind of, what would you recommend to them, about that? Should they ask for a biopsy? Should they go forward with the surgery? What was your kind of decision when you had yours? Because yours I know was recent as well, like Jason's. Sorry, that was long.
No, not at I ramble all the time when I'm asking questions. So my gut says just do it. So for me, it was like I said, I wasn't in denial. I heard I had a mass on my kidney and I knew what it meant. And I think the thing too is I thought back to all of the symptoms I did experience. I've been having lower back pain up until that point. I attributed it to polycystic ovary syndrome, which I also have. And then, things like being tired or feeling cold, and just other symptoms that are actually associated with kidney cancer, or just cancer in general, like even edema, I attributed to other things. And then when I heard that I had a mass in my kidney, I thought back to all of those things. I did, like Ryan, I did research. I looked up. I was like, okay, what is this? How does kidney cancer look? And I'm like, okay, no, it's it. I just knew. And I think that if it's hard and it's easy to be in denial. But if you you just got to push that away and just go with it. Like it's not one of those things where we can wait and see. You don't want to wait and see. Like I see what wait and see does. Like my older sister, she was like she was cured, but like she was late stage because she didn't have doctors who took her seriously with the way she was sick. And then finally someone was like, no, you have cancer. And I saw what waiting and what not getting diagnosed really right away and not taking care of it right away. I saw what it does, and I just knew I needed to. I don't know if that answers the question, but I think it's just you just got to do it. You just have to.
No, that was helpful. And I think that whole concept of having feelings, it doesn't matter if they're negative or positive. It's okay to have feelings. They're feelings. I wouldn't label them as bad or good. Just you need to have feelings. If you don't have feelings about it, I would be shocked. So
I mean, of course, and the thing is, it's like with denial, like that's easy. Of course, I would want to have been in denial, but I think denial would have gotten me nowhere. It wouldn't have allowed me to, and I'm still processing, don't get me wrong. I'm still like, there are days like I'm sitting down, I'm like, oh crap, I had cancer. I'm on active surveillance for 5 years. I am on a 6-month plan for scans and lab work. This, at the end of the month, actually at the beginning of October, we'll decide if we go to a year. But like, it's still a constant in my life. And I'm still like, sometimes forget that I'm a cancer survivor, or rather I don't, have cancer. And so, I mean, it's easy, but it's not at the same time. Does that make sense?
It absolutely makes sense. You're just kind of going in that balance of everything. And I agree for that question. It's something, speak to your physician, speak to your surgeon, speak to your family, speak to, psychology, anybody, pastor, whatever you need to do, because to get over it, move on, get your surgery, learn more, use the KCA, we're all here for you. There's another question. I'm going to shoot it to Ryan. And this is one we could probably talk about for hours, I think. So it was a patient with stage 1, and they're going for a partial nephrectomy, and they're having some trouble getting in. And, trying to ask, how do they push and kind of do the best practices in our healthcare system in the United States? And how do they advocate for themselves with, not perhaps seeing the physician they want, or maybe it is a second opinion or something like that. So what advice would you give this patient, Ryan?
Yeah, our wonderfully designed healthcare system.
That's why I said hours. Exactly.
Yeah, right. I know it's it works sometimes. I think you just have to be diligent, and you have to, you have to talk directly to the departments, because oftentimes what you find out is if you can get a pathway to the doctor will figure out a way that will get you in, especially if they know your situation. I mean, doctors are great. I love doctors, and they're really good at what they do. And what they want to do is they want to help people. And this is what they go to a ton of school for. And so oftentimes I think that you can get caught in the bureaucracy of healthcare systems, where the people that are doing the pointing or whatever they're trying to do what they think they're allowed to do. But and maybe you just got to push a little bit harder to say, well, can you check with the doctor, talk to the nurse? Can I talk to the nurse? So maybe the nurse will say, oh, you know what, Dr. Johnson, I bet that he would want to get this taken care of right away for you. So we'll get you in. I mean, it's going to depend on every circumstance on whether it's different. And I mean, the other option is to go and check out a second opinion. I mean, if a surgeon might get a little bit more motivated if he knows you're about to schedule a surgery somewhere else. That tends, when you start impacting their RVUs, it gets a little bit different story. So.
Oh no, the RVU term. Oh boy. No, I mean, I agree. It's something where, especially, telehealth is here to stay, everybody. And, every center is doing it. We all do it. It's something where if you're having trouble, I really say, send the doctor a message. I answer messages all day, our nurses, everybody. So,
the other thing, I've actually done this before for this or for other things. If you do enough searching, you can normally find a doctor's email. And if you can find a doctor's email and email them directly, they'll forward it to their team and say, can you get this person on my calendar? It's maybe not the way that most doctors would recommend you do it, but I'm just going to say it is something you can do.
And it is you can absolutely, our emails, I think they're out there on most websites. It's just also something where if you just express your feelings and let us know, I agree. You get to a scheduler and sometimes they're like, oh, the first available is X, whatever. But it's just letting the team know. Absolutely. It's usually everybody can accommodate. And like Ryan said, if they can't, somebody can, somebody can, and it's about what's convenient to you. Jason, do you have any comments on that question? I mean, you moved, so you went from, Texas to Seattle. Did you have any trouble getting into the system? I mean, but you had your own team, or was it pretty smooth?
I had no problem getting into the system, but it's because I was able to get in through a referral. I think my first doctor was referred to me, and I didn't do a lot of research on, the doctor I had in Texas. I didn't do a lot of research into him. He was like the doctor at the hospital that was attached to the emergency room that I attended. So I didn't do much there. And then when I was seeing a normal urologist, like just my annual checkups, I was able to get in. I had to wait a little while, but I was able to get in. And then with the referral to the surgeon, same thing. Like, he's extremely busy, but because I came in as a referral, I was able to see. But I think I think Ryan's suggestion is kind of, really kind of the smart way. Like the squeaky, there's the whole saying, like the squeaky wheel gets the oil, and, going through not being afraid to advocate for yourself, calling the doctors, calling the schedulers multiple times, making sure you follow up, and then doing the research on, who it is and, what doctors are out there and who you might possibly want to work with. And, just not really giving up. Like things are hard, just with like everything. But if you're not willing to advocate for yourself, or you're afraid to advocate for yourself, then no one's going to magically do it for you. You really have to go in there and just, almost be relentless and say, I want to see this doctor. So I'm going to call. If I have to call the scheduler every day for 2 weeks, that's exactly what I'll do. And
I know that it's not that the doctor doesn't want to see you. They want to see you. They just like, they might not understand the situation. And if they know that you're super high anxiety, they might try and figure out a way to work it in somehow.
Exactly. So it's just like, don't give up.
Persistence. Absolutely. I mean, it's something where it's like, just speak to your team. I mean, it's just that whole theme, I think, about your diagnosis and advocating for yourself. And it's just so important for anybody with any disease. You don't have to label it on, having, kidney cancer. It's just something that it's hard to realize to advocate for yourself until maybe something happens, right? When you need to go into there, or something you get told something is not to like do that, but it's something to do, whenever you're trying to, our system is, it's the best it can be, right? We have a few minutes left. I just want to have everyone just kind of do a quick little summary about what are, your key takeaways and resources that you would want to leave others with, perhaps that, that get diagnosed with an early stage disease. We'll go back to Anna Maria.
I'd say what helped me was like a post-surgery checklist. So I really thought about the things that would be impacted by the fact that by the cancer, by the recovery. For me, the recovery wasn't just like a couple of days. I actually wasn't fine after a couple of days. Like my core, even now, where I'm definitely in better shape than it was before, I still feel it in my core because of scar tissue and whatever. And then that's a whole nother topic that if you want, you can reach out to me and I could talk about, because I do. But I just thought about all of the things that matter to me that would be impacted by my recovery, would be impacted by the fact that I no longer have a left kidney. And I went into, I hate saying this because it feels so corporate, but I went into action mode and I created plans and strategies for that. I found my support system. I made sure I knew what I had to do. I ordered meal prep, so I could have like 2 weeks of meals because I wasn't going to be able to do anything. And so that's how I kind of handled it, is just, getting yourself together, really evaluating that stuff that's important and having that support system. I will say, choose your support system wisely. You will have people in your life who are either toxic positivity or platitudes, or, are supportive for maybe like the first 3 months. And then because you look fine, they think you are fine. And that's going to hurt. That is going to hurt a lot. But so be selective on your support system. Really look for people who can understand you. I found people through Instagram and Facebook, and I still talk to them a year later, and they're like close people to me, and they're a good system. So I would say those are my takeaways. And Steve.
I love it. I mean, the plan and the meal thing, I'm going to tell my patients that. I'm going to steal that. I love that.
Yeah,
it's a great idea.
Nutrition's important. And so,
yeah, absolutely.
Especially when you don't have a kidney, you have to like work around your protein, and you have to work around your sodium. So it's like having that stuff ready for you, so you're not standing on your feet. And if you have the access and the resources and you can afford it, it was definitely something that helped.
One thing off. Perfect. Yep. All right, Ryan, takeaways and resources.
My major takeaway is that everybody has their own journey, and there's not a right or a wrong way for you to take your journey. And so, I think you want to talk to the right people, so you're getting good counsel to make the decisions that you make, but those are going to be your decisions that you make. But it's all extraordinarily overwhelming emotionally. You're wondering, can I eat this? Can't I eat this? I mean, there's so many, you start worrying about every single little thing. And I think, somebody said this just recently in one of the other panels, of just like, take a deep breath. There's a ton of great success stories out there. The things that you're worrying about probably don't matter quite as much as you think that they do. So just, control what you can try and control, and make sure you're reaching out to, and again, I would keep pointing back to go to KCA. There are people there that are trained to help you find the resources that you need, whether it be emotionally, financially. We haven't even touched on, there's a lot of people that this creates a financial burden for them accessing care. And we can help you help you find those kinds of resources. So those would be my takeaways.
That's awesome. Thank you. All right, Jason, last but not least again.
Wow. Both really well said. And the only thing I would add on top of that, because I think on both of those fronts, that was kind of most of my kind of big takeaways. And I would say like the second, the last one I would kind of add on to that would be just really keeping an open mind in the recovery process. Like for a lot of time, they through anything of this kind of magnitude and this seriousness. And, you're going to being referred to lots of doctors. There's going to be a lot of people passing information to you that's going to go completely over your head in a lot of cases. And I know for me, my first time around, being young and feeling invincible, I was like, I don't need to go to doctors anymore. I don't, what are they talking about? And you kind of have this idea and realizing that, this is a new thing that's going to require changes, and it's a process. It's nothing's one and done, and just, follow medical advice, go to things, see doctors you might not have seen before, fill out their values, see how things are working. If something doesn't go right, you have time to fix it, and just kind of keep an open mind. And don't get too stuck in your old ways. Life is going to change post kidney, post nephrectomy, partial nephrectomy, and that's okay. And if something doesn't go right, don't get down on yourself. Just make these changes, and this is like this ongoing process that you're just going to have to live with. And just don't allow yourself to fixate and get down on yourself for one thing, or don't not go to a nephrologist because you heard someone else say they found no value. Like, just test everything out, see how you feel, because everybody's journey is different and everybody's recovery journey is different. So just keep an open mind.
Absolutely. And I think, that kind of goes with the theme of this topic is living with kidney cancer, right? You are living.
Exactly.
And it's something where wherever you need to do, I'm speaking to everyone listening, and our three wonderful patients here, is you are living with kidney cancer. And there is actually a question about, when you have surveillance, and it's quite rigorous, and I totally get it. And you're getting a lot of CT scans, and we make you guys do them. Maybe I'm a little pushy sometimes. I'll do 3 months, I'll do 6 months, I'll do 4 months. I go over the place sometimes, depending on what I see and how I feel, and discussion with my patients. I know it's scary to also get all that radiation. I totally get it. But remember, when you fly in a plane, you're also getting exposed to a lot of radiation. You're getting exposed to radiation a lot. And we've done multiple studies on the exposure and related to what our surveillance programs are. And we've actually taken it back a lot with our germ cell tumors, because we know when you're diagnosed at a younger age, it can have consequences. And there are active studies kind of looking at that and evaluating what the 5-year plan is. Like Anne Marie was kind of saying, I'm going to be moving on maybe to my 1-year plan versus a 6-month versus a year. So I think it's something to always talk to your doctor, because none of these guidelines are set in stone. And kind of Ryan was mentioning, there's just all these things out there. And when you research it, none of us have the same answers. We all kind of go back and forth, and it's so frustrating. And we're frustrated too sometimes, because like you go to one opinion and this and that. So always talk with your physician and your care team about that. We always have our standard, but everyone is always, you know, what their cancer is and what they're dealing with and what's important to them. So it's always important to ask, but we always think about that too. We don't want you to get exposed, but we do it for a reason, because kidney cancer can return, and we want to keep that surveillance really strict and really on it. But there is a limit to how much is needed. And again, if you're on a trial, it's like a whole different ballgame. We won't go into that, but you know, we'll wrap up here. It's a few minutes late, and I just want to thank everybody. This has been so wonderful to speak with everybody, and I really appreciate all the questions from the audience, and I really hope we can answer them. And, you know, I hope to be invited back for this. And again, thank you, the KCA and Ryan and Anne Marie and Jason. You're all wonderful, and keep doing what you're doing. It's been great.
Thank you, Dr.
Thank
Berg.
you so much.
Thank you. My pleasure.
Bye.
Bye-bye.
Yes. Thank you so much. I don't know about the rest of you out there in, you know, the virtual world, but Stephanie's energy and, you know, the little snippets of dry humor and things that were in there from the group. This was a really refreshing session. So we are going to take another break at this point before we meet for our afternoon session, which will be living with the advanced stage diagnosis. So we're going to take a break until 2:30. Again, I apologize for those of you that went to the survey link. We are in the process of getting that fixed. It looked like there was one question where they were kicking some people out. So we will get to that very soon, but definitely continue to pop back on and see us at 2:30. Thanks.